Good morning, and welcome to another episode of Coffee and Tea with AARP, a biweekly conversation in which AARP staff talks to Connecticut decision makers about policies and programs that are of interest to older adults. My name is Anna Doragazi, and I'm one of the policy directors at AARP Connecticut. Our guest this week is Sean Scanlon, Connecticut State Comptroller. Comptroller Scanlon, thank you so much for joining us today.
Good to see you. Good to be here.
Great. Well, we invited you to join us today for coffee and tea to talk about a new prescription drug discount program that's available to Connecticut residents. But before we jump right in on that, I want to provide just a little bit of context for our conversation today. So before your time as comptroller, you were a state representative from Connecticut's 98th district down on the shoreline. And for part of your time as a legislator, you co-chaired the legislature's insurance committee, and you were a terrific advocate and did a lot of great work to lower healthcare costs, including championing bills to protect people with pre-existing conditions, to establish a copay cap for insulin, and to create Connecticut's first prescription drug price transparency law. So it seems like you're interested in the issue of high healthcare and prescription drug costs. Why has that been a priority for you in your work as an elected official?
Well, I should add that you were helpful personally in helping pass those three laws as well. So credit to you and AARP for helping me. It's important to me for a really simple reason. I grew up, my parents split up when I was 6. I was mostly raised by my mom as a single parent, and my mom ran a small business, almost never had health insurance. And so when I was growing up, I have vivid memories of her, talking to pharmacists at the Guilford CVS to beg them to see if there was a cheaper generic alternative to what a doc had prescribed her for a drug, or if she, got really sick and went to the doctor, she'd be paying cash when everyone else was paying with an insurance card. And so from a very early age, I learned that our healthcare system was not equal and not great. And the older I got, the more I got interested in helping everybody else besides my mom, because I realized that she was not alone. And a lot of people were struggling with the costs of healthcare and access to it, and insurance in particular. And so I ran for state rep when I was 27. Healthcare was the single biggest thing I was focused on. And as you mentioned, I had an opportunity to chair the insurance committee and work, for 8 years on health policy. And then last year was elected to this job, which most people think only deals with the budget and accounting and things like that. But I actually run the state employee health plan, which is the largest health plan in the state. 250,000 people get their health insurance through the comptroller's office. And I tried to use that platform to try to change the healthcare system in our state, which is what my predecessor and friend Kevin Lembo did when he was comptroller, and what I'm now trying to do every day as the comptroller of the state.
Great. Well, so in your first year now in office, you helped, really took the lead on ushering in a new program called ArrayRx. So can you tell us a little bit about what ArrayRx is and how Connecticut became part of it?
Yeah, so basically, ArrayRx is the first prescription drug discount card that the state has ever supported and helped to give out to the people of Connecticut. And Governor Levant deserves the credit for this one because he called me up in January and said, "Hey, I'm going to introduce a bill and instruct you to join this interstate coalition that started out on the West Coast that uses essentially the leverage of states who do a lot of bulk purchasing of drugs to then confer those benefits to everybody in the state, regardless of whether they're state employees or not." And so the governor introduced the bill. The bill passed this past session, and I joined this coalition called the ArrayRx. 3 states are in it now. And starting just recently on October 2nd, a little more than a week ago, we became the 4th state to join this. And basically, all anybody has to do is go to ArrayRx, that's ARRAY, card.com. And within a few minutes, they can sign up, get a discount card that they can use at 98% of the pharmacies in Connecticut and start saving from the day they download the card.
That is excellent. So for folks who are listening today who are hearing this and are interested, how do they go about using this? What is the sign up process like for the card?
Yeah, so like I mentioned, the sign-up process is really easy, and they can do that at arrayrxcard.com. And then they can use that at most, if not all, of the pharmacies. Again, 98%. So I guess not all, but most of the pharmacies in Connecticut. And really, it's a tool in the toolkit. So a lot of folks listening may have Medicare or a Medicare Advantage plan where they have some drug coverage. Usually, Medicare is pretty good at covering the cost of drugs. And under President Biden, it's about to get a little bit better because we're going to finally start negotiating for the cost of drugs, which is a whole other coffee and tea episode we can do. But while we wait for things like the Medicare cost cap, which is coming in a few years, and the negotiation to take effect, this is a tool for folks that perhaps if there's a drug that Medicare does not cover, then you can use the ArrayRx card for that. If you have loved ones and family members who are perhaps younger, who are either uninsured or they have a high deductible plan, for example, where they spend a lot of money to be able to even use their insurance, this card can work for you. And so really, it's meant to not solve the crisis of drug costs, which is a whole other thing that you and I, Anna, are really working about in a different capacity. It's meant to be a tool in the toolkit to help you lower your costs.
So what are the kind of nuts and bolts of using it? How would you use this card, at point of sale at a pharmacy?
Yeah.
Can you use it in conjunction with your existing insurance card or a Medicare card?
Yeah, so you can't use both your insurance and the card at the same time. And so what we're telling people is go in. Most of you probably have a relationship with your pharmacist and your local pharmacy. And most pharmacists are pretty good about trying to help their customers save money, especially for seniors and people who are on a fixed income. And so what we tell people to do is run your card and run your insurance card and see which one is cheaper. And whatever is cheaper, use that card going forward. And so again, it's really meant to be an option. And some people say, well, how is this different than GoodRx or other different cards that are out there? The answer is this is a state-backed plan. GoodRx just got into a lot of trouble earlier this year and paid a significant fine for selling the data of the people who signed up for GoodRx cards. So our data that we get through this is not used for sale. We're not selling your data to people. We're not tracking you. There's no hidden fees as part of this. It's really literally free and already able to be used at, again, 98% of the pharmacies in the state.
Great, and totally voluntary. Connecticut residents don't have to use this card if it ends up not being a good deal for them.
You can download it, try to use it once. If it doesn't work for you, you never have to use it again. There's no annual fee, there's no monthly fee, and it's just meant, again, to be a resource to you. There are some people it's going to save a lot of money for. There are some it won't save money. It depends on who you are, what insurance you have, how old you are, what drugs you're taking. There's a lot of different variables. But we're just asking everybody, give it a shot. If it works for you, great. If it doesn't, it doesn't.
Great. And then, you mentioned, and I'm excited you did, because AARP fought really hard on the federal level for some of the changes that you mentioned related to Medicare price negotiation. For folks who aren't familiar, it used to be the case that Medicare could not negotiate for drug prices with pharmaceutical companies. That changed last year, thanks to federal legislation. So is the ArrayRx program different from these new federal changes? Is there any overlap at all between the two, or just two totally different steps in the right direction?
The way I view it is that the ArrayRx card is a Band-Aid while we try to fix the overall problem. And to me, negotiating for prices is by far one of the best ways that we can overall lower the price. Most people don't realize this, but America is really one of very few, if not the only, Western countries in the world that does not negotiate for prices, which is kind of contrary to the entire idea of America, which is that we negotiate everything. It's a capitalist society, and whoever got the best price usually wins out any sort of competition. That is not the case with drugs, which is why if you look at the cost of the drugs that you take in America and what you pay with them versus what your cousins pay in Ireland or Italy or Germany or anywhere else, it's always higher. And I do believe that negotiation is going to make a big difference. And I'll tell you why. I run the state employee plan, as I mentioned earlier, and we have 50,000 retirees who are on a Medicare Advantage plan right now that we do their health care for. Of the 50,000, in the last year, Of the 10 drugs that we're now negotiating, the state spent $150 million in 1 year. 1 year. So if you think about the fact that that's 50,000 seniors in Connecticut in a state of 3 million people, think about the savings that would come if we were doing that for each and every senior in the country and in Connecticut. That is where we're headed. And that is where I think we need to head for all drugs, not just Medicare. And that kind of price negotiation, I think, is a fundamentally American idea and something that we should be doing for everything.
Great. So that said, what comes next? What are your upcoming priorities when it comes to lowering healthcare costs here in Connecticut?
Yeah. So again, we're getting close to the legislative session. So my team and I are beginning to kind of plan what we might be, putting forward for ideas. I know the AARP is doing the same thing right now. And what I tell people all the time, and you know this, is that there's no magic solution that overnight can change healthcare. If there was, we would have done it a long time ago. It's very complicated. It's very difficult. And there are a lot of special interests that do not want us to succeed and change the system because they're making a lot of money with the status quo. We've gone up against them before together. I'm sure I'll be doing that in the future. At the end of the day, I think back to my mom. I think back to your members, people who have worked their whole lives. They've done everything right. And it's not fair that people are cutting their pills in half or thinking about not buying groceries 1 week because they want to take their medication. That's just not the America that I think we ought to be in. It's not the state that I think we ought to be in. And we're going to always, each year, just try to keep chipping away at this problem until we finally get to that promised land of having affordable and accessible healthcare available to everybody at a low cost.
Well, I don't think I could have said any of that better than you just did. So I think that's a great place to end our conversation for today. Comptroller Scanlon, thank you so much for taking the time to be with us today to answer some questions about this new ArrayRx program. For folks who are interested, could you say that website one more time for them?
Yep, it's ArrayRx, so ArrayRxcard.com, ArrayRxcard.com. It's quick, it's easy, and most importantly, it's free. You can download the card on the website. If you're not a person who loves apps and wallets, you can print out the card and you can take it to your pharmacy, but just check it out, give it a shot, talk to your pharmacist, and if it works for you, start saving.
Wonderful. Well, thank you again to our guest today, Comptroller Sean Scanlon. Thanks to everyone who tuned in to listen to this conversation, and we hope that you will join us again in another 2 weeks for an episode of Coffee and Tea with AARP. Have a great day.